All right, well, welcome back, everyone. We're going to start as promptly as we can. And what I want to do is, we've talked a little bit about hairline design, the local anesthesias that's necessary, harvesting the grafts. Now, this part to me is really a large expression of our artistry as physicians and surgeons in designing the pattern that is going to ultimately dictate where the grafts are going to be. So this is known as recipient sites. We're going to go over this, and we're going to talk, first of all, is an overview of the types of recipient sites that are out there. And really a huge component is also understanding how hair grows. And that's going to be how you as an artistic surgeon is able to actually create beautiful patterns that replicate nature. And then a sequence of just basically how to do it. So we're going to talk about types. There's really, to understand this, the timing is one thing. If you're going to make all the sites at one time, that's called pre-made sites, where the pluses and minuses. Stick in place, which is to make a site and put a graft in. And then we're going to talk about different types of angles, and we're going to talk about different types of sizes or instruments to make sites. So what is better, pre-made or stick in place? And that's a debate that can probably go on forever. The pre-made sites, if you make all your sites at one time, you can see your pattern design very well. But sometimes if you don't have the perfect graft calculation on the front end, you may not have a perfect match, in which case you may have more than you need or less than you need, but the point is hopefully you'll be pretty close to that number. And I personally like to make pre-made sites so I can see my pattern. And then at the end, come back and do stick in place for areas that you have a few extra grafts or an area that needs to be feathered and blended. And so what are the advantages if people just use stick in place? Well, one thing is possibly having smaller sites, because if you make all the pre-made sites and you wait an hour or 2 or 3 hours, the sites need to be larger because they shrink a little bit over time. And if the assistants are doing mainly the stick in place work, then the surgeon has less time, but that means the surgeon may not be able to dictate the pattern design. If the surgeon is doing the stick in place, the time could be much longer, because then he has to wait for the site to be made and then the graft to be placed. I think for me, what I found, and we're going to talk about here, is going to be the beauty of a pre-made pattern followed by stick in place to feather in the areas that need to be done. This is just an example of some of my work with the pre-made sites. You can see these are already designed and no grafts are placed yet, but the site design has been already made. This is just an idea of stick in place, which is someone making a site and then the assistant placing right after that. So stick in place. There are two types of angles, whether to make the sites sagittally, which is going this way vis-a-vis the head, or coronally going this way. And what are the advantages of each one? Sagittal-based sites possibly have less hair transection because you're following along the natural hair pattern. And the negative of a sagittal site is that potentially you have less angle control. In other words, when you put a graft in, your fear is that it looks too perpendicular, which can look unnatural. You want your hairs to be low, but you're worried that's going to slide up. Whereas on a lateral-based site, this is not my work, I got it from the internet, is there may be more angle control because it's not going to come up as much. But especially for someone beginning, it can be potentially difficult not to transect previous grafts or hairs if you are not very cognizant of how that blade goes in or that knife goes in. Instruments, I tend to use bent needles, and we're going to demonstrate that. You can also use what's called solid wires. And then larger instruments to accommodate perhaps more than one follicular unit. And a follicular unit, if that hasn't been clear, is that hairs don't grow in just one hairs. They grow in clusters of 1s, 2s, 3s, and 4s. And you'll start to see that develop as we go into the workshop. And this is to accommodate potentially a couple follicular units or 3 follicular units. These are just examples of follicular unit instruments, the solid wires on top, and these are just standard bent needles that you see below there. It's an 18 and a 19 gauge needle that's bent that can also be used for site creation. If anything you forget, if you remember anything from this talk, I want you to start to see how hair grows. It's so important that when you're doing this that you understand and recognize natural hair patterns so you can recreate it. This is from Dr. Ron Shapiro's, one of his articles, and it just shows you that hairs grow in different angles in different places. The central area here, they all grow pretty straightforward, except just at that lateral centimeter where you're going into the temple-based hair, where it starts to curve and almost cascade and fall down, so going like this and then further and further down. And we're going to show you some of those sites in the workshop so that becomes clearer for you. The crown is a very difficult area to understand. It's an advanced area. I highly recommend not starting the crown for probably maybe in a few years until you start seeing your work come back to you, because remember, your work takes a year to two before you start seeing it come back, and you want to make sure you're doing the right thing. The crown has certain different patterns. This is from Ziering's work, and you can see that the key with this is that it's not a straight pattern, it's a circle or a whorl, and that's really, really important to understand that. When we're making recipient sites, the two big things we want to talk about are angle and direction. Angle refers vis-a-vis to how much tilt up and down from an AP direction this way your site is being made. And the direction has a relationship going this side to side. So when we talk about angle and direction, those are very important ideas to understand when you're making sites. I like this little idea of a box. I came up with this trying to help think about how we can not put hair on the forehead or transplant things that don't make sense and understand pattern. I think of it like a box, because there's a horizontal component to the scalp, there's a vertical component. In the front, vertical component is the forehead. The hairline is at that shingle point we talked about, where it transitions up into the flat plane, and then as it transitions back into the vertical plane, we heard from Dr. Parsley that that's called a vertex transition zone, and that's like a posterior hairline, if you will. The side hairlines, you also heard from a hairline design element, is where the side canthus is, and that goes up like this, and that's where the hairline ends and where the temple hair starts to come down. And Dr. Elliott's actually going to show this. We had some concerns that that we need to go take a step back and do some anatomy discussions, which we're going to cover around 12:30 today. So those are just some ideas of temple hair or lateral parietal hump hair, the central frontal mid-scalp hair, as well as the crown hairs. And if you think of this box model, I think it's quite helpful. So this is just an actual human person. You can see sort of the central forelock here, mid-scalp region behind it, the temple humps on the sides. And again, this all become clear during the actual workshop portion. The bridge going back toward, or the vertex transition zone going back toward the vertex, and then the zone of 3 or 4 centimeter hairline in the front. These are just a artist rendition, and there's some X marks, I'm sorry. This is actually for a book that I'm working on, and you can see that there's angles that are different. And the key, if you remember everything, is that go low with almost all your angles. If the angles are too high, things can look grafty because you can see the insertion points, and it doesn't create visual density. We're going to talk about that more specifically. These are just ideas of keeping angles low, very low, especially toward the front hairline. In the crown area, I tend to go a little higher to create a lift, so it actually, but that's a very advanced topic. I just want you to remember, if you remember anything, is to go lower than you think you need to go. And that's going to be very, very important, especially toward the hairline. So how do you do this? Well, you heard tumescence is so vital, and it's so vital because it protects the underlying vascularity and allows you to have a safe recipient site creation. Unlike the donor area where you want to tumesce everything on the front end, when you're doing the recipient site tumescence, the key with this is to go sequentially, because you're going to spend longer time to make sites than you would to harvest it. So I will put maybe about 10 cc's of recipient tumescence or 20 cc's into the area I'm going to work for some of the epinephrine and Kenalog to take its effect. But then I'm going to sequentially, if I'm going to work toward the central forelock first, I'll put added tumescence there. As that diminishes, as I work toward the hairline, I'll put a little bit more there and reinforce that. This idea that I give credit to Dr. Elliott coming up with, which is the idea that a ship is riding high over the coral plain, is that the corals are your nerves, your blood supply, and if you put a lot of water between the two, your needles and blades don't hurt the coral, and that's a good way to think about it. So you always want to be working at high tide, not low tide. The idea is having the patient's position well. In our 3D demonstration, I'm going to reinforce this idea. When you're working on the hairline, if the patient's sitting and you're working like this, it's very hard to get your angles low enough on the front hairline. But if they're lying back like this and you're sitting, if you think about it, you're going to make your angles very low vis-a-vis the scalp because they're in a supine position. So I find it very easy to have the patient fully recumbent for the hairline work, and my sitting down and working this way so I can make sure my angles are low, because natural hairlines are low with the angles, not straight up and perpendicular. And again, always thinking about making sure that your pattern design is natural, and so that you can think about how hair grows in the hairline, how it grows in the mid-scalp region, how it grows in the temple, how it grows in the crown, and look at people that have hair, and especially if they have closely shorn hair. It's a great way for you to really reinforce your knowledge of understanding how hair grows before you start your first transplant. The other thing that's very important is if your grafts are well spaced out apart, you can potentially see them as grafts. So you want to keep them relatively tightly interlocked. And interlocking it is something we're going to show in the next slide and have you understand that. The other temptation when you're working on the frontal hairline, because your hand goes like this, is to splay all your grafts out like this, which doesn't look natural. It's very uncombable. In addition to that, it doesn't create density, because if you think about it, if you can interlock your grafts going forward and front, they tend to don't book leaf open, and you can create a much greater visual density with the same number of grafts as someone else doing it this way. So you don't want to book leave open everything. And again, that concept will be reinforced with the hands-on work as we reinforce and see how you make your sites. Before you start making your sites, you want to make sure that the grafts that are being made fit. So we always test with each size the length of the graft, and then after we make a few test sites, we then go back and make sure that that graft actually physically fits, and sometimes we need to make some accommodations. So 2 or 3 small sites, make sure the grafts fit before you engage in making 500 sites. So what I usually do is after I start getting back my initial numbers, you first have calculated what you want how many grafts per a certain distance, and once you've gotten that idea of where you want to go with it, you want to then find out exactly, based on a graft calculation, it looks like you're going to have a certain number of 3-hair grafts, certain number of 2-hair grafts. Then I visually plan how many 2 hairs need to be here, how many 3 hairs here, and that's going to come with experience, and some of those elements we're going to discuss more in the workshop. But the goal is to be able to allocate effectively, because you could put, for example, more hairs in the part or more hairs in an area like the forelock, which is in the front, which adds more visual density for someone. So you want to target those areas that have maximal visual density with a little bit higher visual density than areas that may be less important. For example, maybe a little bit further back in the mid-scalp, or areas where it's the opposite end of the part, because the part is where there's a lot of travel distance for your hairs. It's also, if you think about it, right here is more splayed open, so you can see emptiness if you don't put enough hairs in that region. So those are some finesse points that I think are going to be important as you actually go and do this with us in the actual live workshop portion of this. And so the other thing that's important is what I do is I try to put make my sites in the most important areas, because I don't want to run out of grafts. So I'm always mentally calculating as I'm making, okay, I need 300 sites in this area. Well, I need definitely 150 in the front, which are going to be very dense. Then I can feather back. But if I start making them in unimportant areas and I start running out important areas, then we're in trouble. So mentally calculating on the front end where those sites are going to be, I think is very, very important. So we've talked a little bit about the forelock, and this concept is that if the forelock is the area right behind the hairline toward the center, it adds the greatest visual punch, because people looking at you from all different angles give you that visual density when you're seeing the center, because every hair that's in the center is adding visual density from someone looking at it from all angles, versus a hair on the side, which is a little less important because it only adds visual density for someone coming from this side. The finesse point of that idea is really to judge it based on the patient's needs. For example, let's say the person has a lot of hair in the center and just has really deep gullies here. Well, you're going to reverse that concept and look at areas that need the grafts. So if they have a lot of hollowness here, you're going to focus more on the frontal temporal recession. And that's part of the art, is distributing those grafts in such a way, or those sites in such a way, that you get maximal visual density customized for the patient's loss. The extended central forelock principle is that if we think about it, if we take that forelock here and move the hair all the way to the back, then that is going to provide a cutoff point in almost all angles, coming a visual cutoff point of people looking all the way back, versus just the central forelock. If someone sees it here, you're going to see behind the central forelock. So that idea of the extended central forelock is an area that is very important to prioritize density for site distribution. So how do you do it? If you're using slightly larger grafts or multifollicular grafts, I start with that and create that central forelock anterior portion of the mid-scalp first, and then go all the way back and finish that, because as I go forward and blend in my smaller grafts, I can more tightly interlock them going forward than the other way around. I don't know if you can understand that, and we can do some of that in the lab. And then I build my hairline forward, which is very important. If you start with the line, sometimes it looks too linear. If you start back behind the line and move it forward, you can create a line that is not quite a straight line. You want it to be a little bit blurred, and that's really important. So what about the hairline? The hairline should be relatively aligned. It shouldn't be too jagged. Some people I see, the mistake with the hairline is either that it's just so jagged, like 2 or 3 centimeters of big curvy lines, and that's not how a hairline looks, or it's just too straight. So what is important is it's almost like a coastline. It's something that Advance taught me, which is a very, very fine coastline. As you get closer to it, you start seeing those little irregularities of only a few millimeters, and that's something that's important. And that hairline, as I said, especially where the grafts can be exposed, should not be just widely open recipient sites. They should be relatively on the tighter side of things. And then coming back, I skipped that, is making what's called sentinel hairs, which are just hairs standing out in the front, so that it's not just this wall of hair, but there are these little break points of hairs that stand maybe about a centimeter or half a centimeter in front of the hairline. Look for holes. As you make your site design, you want to be using mag eyes or magnification and making your perfect pattern as best you can, then coming back and taking a look and making sure your pattern is symmetrical, that you're not angling your sites off to one side by accident, that your hairline's not getting crooked. Come back and look at it from different angles. Make sure you didn't leave holes in your pattern. Come back and recheck constantly by magnification and non-magnification, and that's going to be very important. And if there's any vascular compromise, you're making these sites, some areas that look dusky or white, nitropase is always important to have on hand, in my opinion. Again, this is just some sites that I've created here. These are sagittal-based sites, you can see. And you can see that the hairline is pretty straight, but there's a little zone of irregularity. And then there's you can see those little hairs that stick out. We talked about sentinel hairs that just blur the line a little bit. But it's not a jagged line. It's just a micro-jagged line. And that's something I want to emphasize. These are coronal-based sites. We talked about that, which I like to use those in the temple. And the temple is an area that I really encourage you, if you're just starting, don't do temple reconstructions, because if they're not flat and well angled, they look very artificial. And if they're not placed well by your technicians, they look very, very bad. So the coronal sites, remember, are the ones that go like this to the skin, and that allows me to get my angles really, really flat. So I tend to prefer to use the coronal sites for the temple area, where I can keep my angles relatively flat, really, really flat. This is very low. This has got to be super, super low in the temple area. This is just a close-up of my hairline work. You can see it's pretty straight. And if anything, actually, what's interesting is if you look at this, there is actually, let me do this. There's a little hole in the front, and I don't know how to get this work here. But there's a little hole in the front. That little hole in the center front is an area that I should go back and make a site for. So it's just something, when you're going back and checking, it's toward the midline if you see it. This is a vertex or recipient site for the crown. You can see it's a whorl pattern that blends up to the center. This is more of an advanced recipient site creation. We're really going to be focusing on mid-scalp, but hopefully there's a little time to show you that as well. And this is a female pattern hairline. It's not the same as a male oftentimes. There's a cowlick. There's a little bit of a curved shape. It's a much more advanced topic. We may not get through all of that in this course. It's going to be focused on male hairlines, but tomorrow during the workshop there's going to be a little time extra for that. And these are just some results. You can see the cowlick. You can see fixing what's a male pattern loss into a more feminine design. You can see that the hairline on the left is too straight. The angles are poor. It looks almost kinky because of the way that the assistants place the grafts in, and you're going to hear a little bit about assistant quality control. This is a one session correction of that. Also poor density. This, you can almost see the pitting where the grafts are placed too deeply. The angles are poor. The hairline design is not natural. And this is just, it's a one session correction for that. You can clearly see here why the graft angles needed, the recipient site angles and the concurrent graft angles have to be low, because the angles are so high on the left that they look completely artificial. The hairline's too straight, it doesn't match the temples, and this is a reconstruction of that. And they're just showing you what kind of visual density you can create when someone has good donor hair density to rebuild the whole area. So the conclusion of this is really thinking about how hair grows and how hair is lost. If you can understand those principles, it begins as the first stage of knowing how to rebuild hair. If you understand how hair grows and how hair is lost, then you can actually recreate the patterns that represent a natural look. So I'm going to do a live 3D demo in a few minutes right here. Barbara, is she here? Great. Okay.